So my name is Ryan Imgrund. I am a biostatistician. I'm also a high school teacher. I sort of stepped into COVID back in March when I came up with some early models about COVID-19 more for fun. And since then, I've been doing some work for a bunch of GTA hospitals, the Greater Toronto Area Public Health Units, for Ottawa Public Health Unit, and then also a few major corporations as well. So that's kind of what my involvement is with COVID-19.
This isn't a hobby. This is actually your career is doing this.
It was a hobby for like 1 or 2 days when this first started. And I stuck something on like Twitter online. I stuck some like early modeling, and immediately South Lake Regional Hospital in like a new market reached out to me and said, "We saw your model online. We want you to work for us." So it literally turned from me making one tweet online to they reached out to me. Then it was Ottawa Public Health. It was Peel Public Health. There's been a whole bunch. So now it's really what I do. I'm still an educator, but the second school's done, I'm like up all night doing this. So
What is a biostatician?
very good question. That's the most commonly asked question. It is someone who marries math and science. So basically, someone that is able to look at the science and is able to put a mathematical spin on it. It's something which I've been doing since back in the early 2000s. But at that time, it was more looking at bacteria, looking at like Campylobacter, which is a like chicken bacteria, and that's like back when I was working with the Public Health Agency of Canada, and it was more looking at these statistics behind that. It was interesting work, but at the exact same time, it was more like foodborne poisoning stuff. So as long as you cook your food properly and you make your food properly, you won't get sick from that. But then all of a sudden, this virus came around, and then my modeling skills and my public health experience became a lot more beneficial.
Do you your your marriage between science and math, is that just in what you do, or do you understand the science or just the numbers?
Yeah, I think that's what sort of separates me from other people, is that I really know the science and I really know the math as well. I may not know the math as well as other people. I may not know the science as well as other people, but I have a strong enough knowledge in each of those that I can really bridge the gap between the two. So there's a bunch of projects which I'm working on right now, which is looking at the science, looking at the math, and then just really helping to bridge those two teams together. And I think that's really important to have someone that like dabbles in both of those fields.
That's awesome because I was expecting biostatician to mean just numbers, but you live up to the actual title on both sides.
For sure. And even sometimes it just simply means setting up studies as well too. So in other words, um, if I'm the one analyzing the numbers, it means to basically assist people with setting up the studies as well. Because if you can help them set up the studies, you can tell them, what they need to look for, what they should be measuring, what they should be counting, so that when it comes down to the actual analysis, it's a heck of a lot easier because the study's been done right from the start. So that's something else which is done too, is basically working on studies and just making sure that the study is set up in the right way.
So where do your numbers come from?
Yeah, so my COVID-19 numbers, they come from a database in the province known as IFIS. It's our like public health like agency that oversees all of Ontario, and they update that like every single morning. So we've got actually a really good database here in Ontario. I've actually worked with several North American databases, several European COVID-19 databases, and I can tell you the like data here from Ontario, it's really, really good data, and we release it in a very timely manner. So that's the one thing here that I really think people should know, is that the data that we have here in Ontario is shared really, really openly, and it's not the same in many other countries across the world.
I- in the list of questions, this is going to merge a few of them on you,
Yeah.
but you're talking to people who really do not like the current government and what they've been doing. So there is a distrust, and there's a lot of people who have growing distrust. So how do you guarantee the integrity of the data? Who feeds that data?
That is a fantastic question. And you know what? I'm the exact same way. And that's one of the reasons that I like kind of got into this, was because, the data which was out there, it can become politicized when you interpret it. And I think that's the big thing too, that you can basically twist numbers to say whatever you want them to say. And I think that's what happens sometimes. If you want to have a lower daily case count, you just simply test fewer people. If you want to have a higher daily case count, you can so there's things you can do to actually change the numbers. So here in Ontario, there's at least enough data that is out there that even though it can still be tweaked to say certain things, you can analyze it in a way that you can stop that from happening. For instance, I know that every day here in Ontario, we get a daily number release, and that's the number of cases which we have. Our Minister of Health puts that out, but there's no deaths associated with it. It's here's the numbers, here it is in each region, but there's no deaths associated with it. And I have a big problem with that when you're not, speaking about one of the biggest aspects of COVID-19. It's how many people are actually dying from it. How many hospitalizations do we have? And that's the data that is there, but it's not the data that is shared with the majority of people. And that's a shame.
With what you just said, kind of leans towards circling back to the trust issues. So, are you doing what you're doing because there's trust issues with no one specific? You don't have to name names, but you call out a lot of people constantly. But is it because you're trying to prevent the numbers from being used that way?
That's exactly it. And I think we've heard, for instance, I'll use an example, the Minister of Education all the time is referring to 99% of students don't have COVID-19. And, it's not a fair percentage to use something like that. What we should be looking at is when there are schools that were actively testing everyone at the school, we're finding a lot of cases. There was a school in Windsor where 350 students were tested. 41 students had COVID-19 and 8 staff members had COVID-19. So in that school, certainly 99% of students didn't have it. I think the thing that we need to see here in Ontario is that we have a school screening tool that doesn't do a very good job of actually telling people to get tested. The Ontario screening tool says to you, you need to go and get tested if you have these symptoms, but the school screening tool says, stay home from school, you don't need to get tested. So we miss a lot of those cases. So therefore, when you say 99% of students don't have COVID-19, well, it's 99% of all students, which unfortunately includes the online students. It includes students that you're saying don't get tested. It's students who you are saying you have a classmate that has COVID-19, but you don't need to get tested because you're going to isolate anyways. And that's where you can tweak the bottom of your fraction in order for it to say whatever you want to say, and you can come up with those numbers. For instance, the stat that I like to see is that 9% of Ontario schools right now have multiple active confirmed COVID-19 cases. 9% have more than one case that is active and that has been confirmed. I think that's a real damning statistic, and we've never heard the Minister of Education say that one yet.
With the schools, because I just watched you have a hell of a day the other day on Twitter where when you're saying things like because you I don't know if it was a recommendation, but you put out there it's time to shut schools. Don't bitch at the teachers, don't get angry at anybody, shut down the schools. When
Yeah.
you're saying that, is that strictly from the science and the math, or is that a personal opinion? Because you got a lot of flack for that, and you had a very long conversation that evolved and blew up because you said it's time to close schools. That's the numbers saying that, right? That's the science saying that.
And that's the number saying that. There was actually a fantastic study that was the Science Journal, which is one of the best journals in all of science. And they basically publish data, which is really, really good. And what they looked at is, if you think about it, we have 200 countries across the world. And each country is doing something different. So they said, you know what? Let's analyze what every single country has done, and let's see what impact each of these things has actually had. The biggest thing with the biggest impact worldwide was moving schools and universities online. And that was worldwide, looking at 200 plus countries. That had the biggest impact, was moving schools online. And I understand that when you move schools online, it causes a heck of a lot of issues. I understand that. And I think that's an issue for sure, that when you move schools online, you run into complications because there are families who require school not just for the education piece but for the like piece involving childcare as well. And I think that's where the government needs to step up and say, you know what, we shut down schools, we move schools online, but here's what we're doing for essential workers, for those who are disadvantaged. And that's what we're not seeing. In fact, if you think back to serve that we had back in March, that was more of a federal program. That was simply federal money that was floated to like keep people earning money at that time. The like provincial government, they didn't offer anything. All that they've really offered is just $200 for like every so often for every family in education. Whether they be online or whether they be in the person. Here's some money, and that's it. I mean, what should be done is that if schools are moved online, they need, the government needs to understand it's a problem. It's going to cause issues when you move schools online, as you saw. There's going to be a lot of angry people with that. But the science shows you need to move schools online if you want your cases to drop. That's what the science says. Now, the science also says with the retail piece, it says that if you allow even non-essential businesses to open and reduce their capacity to 20%, then you're able to open up even non-essential businesses as well. Because it stands right now, we've shut down a lot of non-essential businesses, and we didn't really need to do that. We could have had some of those businesses still open at like 20% like capacity, and we could have had an impact that way. The third thing that studies have shown internationally is that reducing gathering size to less than 10 has a significant impact. So it's those three things that universal studies that look at universal data have shown: moving schools online, reducing retail capacity to like 20%, and then having gatherings at 10 or less. Those have the biggest impact.
Uh, when you're doing your science and that and the numbers and you're making your suggestions or however, I don't know if it's suggestions you make, but when you're taking part in any of these forming of ideas, it's you can't you said you can manipulate or interpret the data certain ways to push certain points. And you don't, by the way, have to answer this.
Yeah.
But to me, it seems like they're not listening because of what you just pointed out. Schools being open and stuffed means parents are still working. And closing smaller businesses means bigger business. This is where a real big distrust is coming from because are they using COVID and the numbers to justify this, to shut down smaller businesses, force parents to stay at work instead of supporting and all that? And you don't have to answer it, but that's one of the main things that people in Ontario are sitting there grappling with.
And I can absolutely see that. And I mean, if you think about what we've done right now, we have schools open right now, we have non essential businesses closed. And we look at like Toronto, we look at like Peel Region, they have been in a supposed lockdown for 28 days. Their numbers aren't going down. So obviously, whatever we're doing is not working. So it's really like plateaued the cases. I mean, I think like Toronto is still experiencing growth. Peel has kind of plateaued, but we're not bringing those cases down. And really, what a lockdown is supposed to do is supposed to bring down those numbers. It's not supposed to plateau off the numbers. So whatever we're doing now is not working. And I think the reason it's not working is because it's not evidence based what we're doing. We're doing things that are making people happy. And unfortunately, at times we've got to make those difficult choices. We've got to do what's difficult, but then we need to like provide support to those people that are disadvantaged by those difficult choices. I think that goes hand in hand with the whole piece too, and it's not what we're doing.
On the opposite end of that, if we did shut down, say they're talking about possibly shutting down for a couple of weeks, or a month or something like that. But if we did shut down for 2 weeks at the start of this, or relatively close to the start of this, would COVID be gone, or would it just have delayed?
Yeah, I think it would have kept our numbers low if we did the right thing from the start. I mean, like I'll use an example of Six Nations. They're here in Ontario. Um, and what Six Nations did is back in mid October, they were seeing skyrocketing numbers. They were seeing around 300 weekly cases per 100,000 people, which, if you look at like Peel right now, they're seeing 200 weekly cases per 100,000 people. So they're seeing more than Peel is seeing. Now, they went into a lockdown, which meant moving schools online. They moved schools online. They gave very clear communication to the Six Nations residents. And now, guess how many cases they have? Zero. They brought it down to zero. And the biggest change they made was to have schools move to an online environment. At the same time, what else they did is they also discouraged people from traveling from one region to the next. And that's something that here in Ontario, we've kind of suggested, but we haven't really enforced. Because I know in York Region where I am, when York Region was in the red zone, but Peel and Lake Toronto were in the gray lockdown zones, our malls in York Region were visited by 39,000 people from Toronto and Peel over a few weekends ago. 39,000 people visited York Region malls. Now, with that being said, I'm not going to blame the Lake Toronto and Lake Peel residents because it was suggested that they stay home, but it's Christmas season. You know, the postal service is going to be very slow at this time as well. And if you need gifts and you're just told last minute that, you know, your shopping malls are closed down and we suggest you don't travel, but you do what you want, people are going to travel. And that's another part of the unclear messaging, which I think we get here in Ontario.
Did you not kind of, and isn't it all kind of leading towards like what we're doing with the schools is like the number one problem we're facing right now? Like you had
Yeah.
talked about lessening the capacity for non-essential and that and opening it up. That's actually more exposure potential,
Yeah.
but the solution would still be because you're closing schools and opening those businesses, it's still safer. So it sounds a lot like schools are the issue right now.
Right. And also, just to add to that, too, now that like 20% applies to essential businesses as well. And it's something that we're not doing. I mean, one thing that we have seen out of data from the US, there was a Chicago metropolitan area study done where they actually looked at cell phone data and they found, you know, those who had the COVID-19 like positive diagnoses, where were they in the previous week or so? And they were in grocery stores. They were in these other places like that. They weren't in these non-essential businesses. They were in these grocery stores. And the issue was not only were they in some of these big box stores, but they were in them for a very long time. It's called the like dwell time, how long you spend in a store for. And as we know with COVID-19, the more exposure, the more lengthy your exposure is to COVID-19, that's when it becomes more riskier in terms of you actually getting COVID-19. So I think that's one thing that we're, you know, seeing is that the grocery stores, big box stores, they're associated with cases. But if you ask people how many people went to a big box store in the last week, we'd all say we went to a big box store. So therefore, what they would say is, well, you know what? Because you all went to a big box store, we can't say that the big box store caused the cases, so we're going to keep them open. And if you think about it, it's the same thing they're saying with schools. Well, we know these students have COVID-19, but they were in the school, but they were also at a big box store. They were also here, they were also there. So we don't know where it was from. But once again, studies worldwide show that when you shut down schools, when you move like businesses to a lower like capacity, you will reduce COVID-19 transmission.
One more question on this current topic is you said that these studies are worldwide studies. You you're going based off of the numbers, so the numbers aren't going to lie to anyone who knows how to look at them and look at them the same way you are. And school, 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 school. I was expecting to have a talk about school because of your conversation with a whole bunch of people the other day, but is this like willful neglect when you have all of this information and the government's just ignoring it? Well, I don't want to say ignoring it. Are they choosing not to follow it because of whatever reasons they may have?
I think what it is that they speak to many stakeholders. And I think that can be a negative thing when you speak to stakeholders in every single area and you have a lot of hands in the pot, then you're responsible to all those people. And I think that's what happens sometimes, is that we open up like discussions to so many groups, to so many people, we get so much input that it's really tough to make the right choice, because you're putting a face to the retail businesses. You're putting a, face to essential workers, you're putting a face to schools. And I think sometimes because of that, we're neglecting doing the right thing. So I think that's, in my opinion, why we're not seeing the government act properly. But I mean, like, I've been yelling this stuff since like August, that if schools open, we need to make schools safer. That's one of the reasons that I like consulted with Sick Kids on their opening guidance for schools here in Ontario. They released that document. They made many, many suggestions. I, suggested many of those too. And the government just kind of handpicked which ones they wanted to do. And one of the biggest suggestions, which I made, which the Sick Kids document had, is the class sizes need to be 15 or less. And what do? They opened up schools without having numbers 15 or less. So, I mean, that was, so that's the thing, is that even when they went out to actually seek out proper advice from Sick Kids Hospital, which, has real no education ties, and Sick Kids said this, the government chose to do that. And I think that's one of the issues, is that they're not following advice. They're kind of picking and choosing what they go with. And that's a real problem.
Sarah, did you want to ask something there?
Yeah, I just wanted to mention that they've been saying all along that the second wave was going to be worse, and here we are. Of course, second wave is worse, and it seems almost like it's not being taken as seriously as what the first wave was. The stores had us lined up outside, waiting to get in. They didn't let as many people into the stores. Uh, there was limits on products and things to that end. Reduced hours at the stores, and we're not seeing any of that at all. And I don't know, it baffles me that here we are, of course, second wave, and definitely seeing it worse than the first wave, like they said it was going to be, and they're just making it harder on themselves, it seems.
You're absolutely right. I mean, you said absolutely perfectly. I mean, there's really nothing I can add to that, because you're like dead on. We treated this first wave so different than the second wave, and we knew the second wave would be worse. And here we are. You said it, Sarah.
With what you said, or what Sarah just said, there's people get fatigue in just about anything after it lasts long enough. Is it because of the way we handled the first wave and people adapting to what a pandemic is and just the change in life? Is it people's fault that this is still going the way it is? Because up to this point, we've said, well, this is the government's fault for not listening to experts and choosing maybe to try and they are government, they have to worry about economy and so on and so on. But is it also our fault?
I've actually given a lot of thought to that. And I think one of the things, and I'll go back to what Sarah mentioned about the first versus second wave. If you think back to the first wave, we started with intense restrictions, and then we loosened them up. And it took a bit for us to get used to those intense restrictions. But in the span of like in 1 week, I think everyone was kind of used to, okay, things are going to be different for quite some time, and we adapted to it really quickly. And then we loosened the restrictions from there. This time it's sort of the other way. We're adding a new layer of restrictions each time, and those layers are not really based on science at times. And it's going to frustrate a lot of people when you make decisions that are not actually data based, and when you incrementally add in restrictions versus add a bunch of restrictions and then you take them off. And I can use this whole like teacher analogy, and even like parents will appreciate this too. If I go into my classroom and I set no rules on the first day, and each day I add in a little small rule and a little small rule and a little small rule every single day, eventually the students are going to tune you out. They're not going to listen to you. The best way that you can parent, the best way you can teach, is you set restrictions. Here's what I expect. And you can, remove some of those restrictions when you see good behavior. And I think that's what happened in the first wave. And we're seeing the other kind of bad parenting, bad teaching approach in this second wave. And I don't think it's people's fault for that, but I think just naturally, this is how we respond to restrictions being added versus restrictions being loosened.
Can your numbers predict future trends, or are they strictly a snapshot at the time you interpret the data?
That's an awesome question. So actually, some of my work with South Lake Regional Health Center in the first wave, which is a hospital in Newmarket, was like predicting ICU utilization. So in other words, using current case numbers, how many ICU beds, how many ventilators we will need for the foreseeable future. And so at the time, we didn't know what this would look like. We didn't know what our numbers would be. So one of the things that I was highly invested in with working for South Lake was to find some kind of a mathematical number that would show us, what will cases look like in the future. And one of those values that I found was the most helpful value is something called the reproductive number. Now, this thing, which is also called the R value, is a number of secondary infections which one primary infection causes. So, for instance, let's say if I had COVID-19 and I gave it to one other person, that has a reproductive value of 1. One infection is causing one secondary infection. If that person with a secondary infection then also gives it to one other person, that's still a reproductive value, or an R value of 1. And you can imagine that if one person always gives it to one person, we will see cases plateau. And that's about what we're seeing here in Ontario right now. It's slightly above 1. So in other words, 100 cases is leading to slightly more than 100 cases. So we're seeing small. Now, what we want to see is we want to see that reproductive rate like down to 0.7. So in other words, 100 cases is going to lead to 70 cases. And it takes around 4 days for that to happen. So in other words, if you have 100 people sick now, 4 days later, they're going to pass it on to 70 people. 4 days after that, those 70 people are going to pass it on to 49 people. Those 49 people are going to pass it on to around 36 people. And you can imagine that in no time, we can get those COVID cases down very, very low. So in Alberta, for instance, they had a reproductive value of around 1.1, which doesn't sound that high, but the cases got out of control in no time. Here in Ontario, when the COVID-19 first started, we had a reproductive value of 2.8. Now that may not sound like a lot, but that means that 100 cases leads to 280 cases in just 4 days. That's huge. In no time, if that reproductive value was left the way that it was, this would have ultimately infected almost every single person here in Ontario. And that's why we put the restrictions in that we did, so we could get that reproductive value down. So that reproductive value is a really good value that looks at what cases will look like in the future. If that value goes above 1, you'll see cases rise. If it goes under 1, you're going to see cases drop.
So with that, it is you because I found out in this that you actually understand enough of the science. We don't really know what happens with the long-term effects of COVID. We don't know about the vaccines and we don't really know about the future, but you kind of do with your predictive numbers. So is 2021 going to be worse?
Well, I think the start of 2021 will be worse if we don't implement further restrictions. So I think that's the first thing which we need to do, is we need to implement further restrictions, because yeah, you're absolutely right. It is going to get, it will be worse for sure. If you think back to the first wave, we kind of peaked like the middle of April, and that was following intense restrictions. Now we're kind of, falling back, because now it's like December. At this time last year, we only had cases in Wuhan, China. This was not anywhere else at that time. And you can see, though, once it gets to other places, it can spread really, really quickly. So now we're in a situation where January and February will ultimately see growth of COVID cases, and we're starting at 2,500 COVID cases, and we'll see growth from that. Versus wave 1, we saw growth from 0 cases, from 1 case, from 2 cases. So the issue is when you start to see growth from an already high number of cases, things will get out of control very, very quickly. So I think that, January, February, March are going to be really, really rough if we don't do something faster. And just to like tag that on to the whole vaccine piece, one thing that we should note is that we're going to be vaccinating those in long-term care facilities first, which is fantastic. It's the absolute right thing to do. We're going to be vaccinating healthcare workers. It's absolutely the right thing to do because long-term care facility residents get sick when healthcare workers bring it into the home, and then one long-term care facility resident passes it on to somebody else. Now, the only issue with this is that we will decrease mortality, which is fantastic, but we're not going to stop community transmission of COVID-19. We're just going to stop some of those deaths from happening. So I think what will ultimately happen is that these like cases will kind of trickle down into the younger population. We're going to see those that are younger become ill because we're like protecting the older population, but it's going to run rampant in the like community for quite some time. I think it'll probably be more realistically April or May before we start to see these numbers tick down a bit, unless we implement some very, strong restrictions. And then I'm hoping that we get a nice vaccine rollout so that by the end of this summer, maybe when September comes, we can start, things up again, with very, very few, if not close to zero, the COVID cases.
Out of curiosity, is I get the concept, the basic concept of herd immunity. And I've been saying that the only reason I could see schools being open is they want to try and get herd immunity in the kids and that. But how come with it getting to this point, like things have constantly been getting worse for us? There was sometimes overall it's worse.
Mhm.
So how come that hasn't happened? If
Yeah.
I know a lot of people are saying that's not the goal, one because the humanity that you have to kind of close your eyes to in something like that, but it was a legitimate option to try and force herd immunity. How come it hasn't happened naturally after a year?
Yeah. Well, for instance, we'll look at like Sweden as an example. That wasn't fully their approach, but they did keep things open. They did expect society to kind of, like take onus on all this. And if you look at Sweden now, they have the second most cases per capita in the whole entire world. So that was their approach. And now what they're seeing is that hospitals are overrun. They're going to have to go into a formal lockdown because that was their approach, wave number one. And we can see now it's just simply not working for wave number two. Now, here in Ontario, we find that we only catch about 1 of every 4 cases, and that's based off of like blood studies. So, in other words, they can actually like check people to see if they have like antibodies, which show that you were infected with COVID-19. And what they find roughly here in Ontario is that about 4 times as many people have antibodies than have actually tested positive. In other words, here in Ontario right now, we have there have been about 150,000 cases, which means there's been about 600,000 Ontarians infected with COVID-19. Now, that sounds like a lot, but that's maybe 2% of our population. For something like herd immunity, you need like upwards of between like 40 to 60% of the population infected. So imagine what Ontario would look like now if we had 20 times the number of daily cases. We would achieve herd immunity, but as you said, you'd have to turn your eye on humanity because we would see 20 times the number of cases that we're seeing now, and we can see what this is causing.
Sir, were you lifting your finger to ask a question?
No, but I thought that there was some speculation that the virus mutated a little bit like a regular cold or flu, so that it was hard to get a full herd immunity because it was kind of like a family could pass it over itself several times over because it mutated that slight little bit.
So there there are some issues for sure with mutations. Now the vaccines, thankfully, work on the like part of the COVID-19 called the spike protein, which does not change that much. So that's so that's why these like vaccines hopefully keep immunity like up in those people for quite some time. So that's the one piece with the whole the COVID-19 in terms of mutation. Now, you're right. The issue with this is that we have seen people are able to get COVID-19 a second time. We have absolutely seen that. So there's various strains of COVID. So yeah, it is like possible to get a different strain of COVID a second time. Similar to a like cold, where you get colds multiple times because there's slightly different strains of colds. And so what the ultimate hope is that the COVID-19 doesn't mutate so much that the spike protein changes, which just stops vaccines from actually working properly.
With talking about the failures that have come into place, or however you want to term it, because I don't think it's failures if you have people like you sitting saying, here's a solution, and they don't act on that. That's them making the choice. But there's also another element to this that to me has absolutely failed, and they've failed because they're the media. They're supposed to keep people informed. So why aren't the media constantly pushing the message you've been pushing for months?
Yeah, so you know what? It's interesting because I think that the media has done a fairly good job of at least holding the government accountable. Um, I know that from listening to some of the like press conferences that our government has had, some of the best questions that are that the government is forced to answer come from some media members. Now, that's not all media members for sure, but there's some media members that really, really push the government on these issues and force them to respond to things. With that being said, I mean, at times the media also turns a blind eye to things too. I mean, I'll use last week as an example. There was, like audio shown where like Dr. Williams and also Dr. Yaffe were talking about, what they thought was, their microphones were off. They had their papers in like front of them. And then like Dr. Yaffe, our associate medical officer of health here in Ontario, said, "Oh, I just read whatever they tell me to read." Well, you're the associate medical officer of health. This information is supposed to be coming from you. What do you mean you're reading what other people tell you? Now, my whole issue with that is that wasn't really like pressed by the media. If I was a media member, that would be the first question I'd be asking if I could address Ford Nation. Why is the associate medical officer of health reading what other people tell her? Why is she not entitled to give her own opinion, her own thoughts about COVID-19? And there could be many answers for that, but it's those things that I think the media needs to do a better job of actually pushing, of holding the government accountable. But I do think so far they have been able to get answers from the government that I don't think we would have gotten, like other ways.
We've talked about everything pretty much up to this point and a little bit of predicting or projecting. With the vaccines and that, will you still be involved in tracking effectiveness and um, the outcomes? So I know the computing power today is immense. We can break things down to the finest details, but how come maybe you haven't and others have and I just haven't seen it? How come we don't know absolutely every way this is affecting every demographic? Like we know overall that certain demographics are affected more, but it seems to me more situational with the poorer you are, the more it's going to affect you. But that doesn't break down. The three of us are very different people,
Yeah.
yet we don't know how it will affect each of us. How come after a year that's not something that's here's the COVID page for rheumatoid arthritis, here's the page for AIDS here, and so on.
Yeah, you know what? That is a fantastic question. The only thing that we like do know is that the more comorbidities you have, if you get COVID-19, you will have a worse outcome. In terms of who will actually get COVID-19, you're right. It seems to be like areas where essential workers live, where they don't have ways to be able to not go into work, where you can say to someone, oh, that's fine, just use a sick day. Well, I don't have a sick day. I can't use a sick day. That's not an option for me to just simply call in sick to work. It's Christmas time. If I call in sick, they are going to fire me, and I'm also going to lose money as well. And that sticks individuals in a very, very difficult spot. They will then go to work. They're going to pass it on to other people, and that's not to blame those people. It's to blame the system that it's sort of set up that allows this to happen. We don't have a good paid workday system here in Ontario. We don't have the government really pushing for employers to say, you know what, if your employee is able to work from home, they 100% must be able to work from home. And there's many of us now doing jobs in person where we don't need to be in person. There's ways too to make these workplaces safer, reducing capacity. Once again, not just reduces COVID numbers, but it helps out essential workers as well. Because if you had a store that had lower capacity and you allowed them to be open 24 hours a day, there may be some workers that are like, you know what, I want to work between 11 and 7 because I can find daycare at that time. I can have a family member look after them. I can have a spouse look after them. That may be an option for some people to actually better work during those hours. It may also work for other people to shop during those hours. And it would help with COVID-19 transmission because then you'll reduce the number of people there during the day, and you give essential workers an option to maybe work outside of those hours, and you'll also keep those essential workers safe. So I think there's, all of this stuff seems to be separate, but it's really, really intricately tied in together. Schools, the retail sector, gathering sizes. There's so many pieces to COVID-19, and that's what makes it so difficult to kind of, figure out some of the things which you were asking about and that we still don't have answers to.
Businesses have been, I don't want to put any kind of descriptor on it. Businesses have profited the most they ever have during the pandemic. Is it maybe best to have that lockdown that they want? I know some are calling for it to start happening now with 40 cases per 100,000, but we're hearing it's most likely going to be the first couple of weeks of the new year. Is it not time that they support their workers for a couple of weeks and allow people to stay home? Because if we just do these lockdowns and people don't have protection, you're talking to two people who haven't had any support during the entire pandemic. So to know what that would be like for a family of 4 with a couple of kids and stuff like that, it is going to cause massive issues. So is there a way to do that lockdown where it doesn't create a tenfold mental health crisis in the province?
Yeah, well, I think the issue is that we're in a state where we've neglected this for so long. If you've been following me on Twitter, you know that I've been calling for action to be taken since the middle of August. And that was not to fully lock down in August, but in August we could see the cases start to creep up. And that's when you need to start some of these incremental things. So let's say, for instance, back in August when the numbers were creeping up a bit, okay, you know what? Let's just move the high schools online in some of the in some of the areas that have a lot of cases. Only the high schools. So that may solve some of those, some of the issues some families may have if you only move high schools online. Then it opens up spaces for elementary students to move into. So there's, there's stuff that we could have done back in August. We could have reduced the capacity of stores to maybe, 90% or 75%. Things that wouldn't have had a huge impact, that may have at least been able to cause our numbers to grow, but not as much as we wanted. And then once we see them grow even more, we introduce more effective strategies. What we've been doing more recently is we've been introducing a number of ineffective strategies. And I think that's the whole problem, is that, we do have different things that happen from green to yellow to orange to red to gray. But if I asked any of you right now, what's the difference between green and yellow? You wouldn't know. I wouldn't know. I'll bet you 99.9% of Ontarians would have no idea. And I follow this every day, and I don't know the difference between green and yellow. Yellow and orange, I don't even think I know the difference between yellow and orange. You get from orange to red, there's a few changes. I still couldn't tell you what those are. And that's a really big problem. There needs to be very set things that if you move from this to this, store capacity goes down to 40% or 20%, or schools move online. We're making these little changes that have no significant impact. And that's why our little color framework isn't green, yellow, red. It's green and yellow and orange and red plus and gray and dark gray and just you name it. We don't have a red. We haven't reached the top because we keep on adding in things that we probably should have added in earlier on. So, to answer that question, unfortunately, we're in a state now that our inaction for 4 months has caused us to have to take more serious action. And that's what the real shame is that we haven't acted for the last 4 months. And that really is the bigger story. Why didn't we act for 4 months? Not, why are we acting in such a way now? I think we're forced to act in a way now because we pretty much did nothing for the last 4 months.
As it is right now, if it was your call, because you talked about closing schools and reducing capacity and reducing hours and so on, if it was your call, would you lock down or would you do the things that you were suggesting about close schools, reduce hours, work around people's schedules and so on?
Yeah, see, I think, my three kind of things that I would do. One, for sure, move schools and universities online for at least the 2 weeks following Christmas break. Now, we already have them online for the next, or sorry, like out of school for the next 2 weeks because schools aren't open. And then if we had them for the other 2 weeks following the break, that would be beneficial too. Now, with that being said, that needs to be announced as soon as possible so that we can have families, we can have parents make choices, we can have workplaces make choices. We shouldn't be, announcing this the very last day. Oh, hey, look, here's what's happening effective Monday. I had kind of, asked for this to happen since the middle of November. And you can imagine if this was announced the middle of November, schools will be shut for 2 weeks in 7 weeks time. That at least would give families time to make, at least some changes, some alterations to their lifestyle that they could maybe better cope with the 2 week shutdown of schools. Now what it seems we'll do is that we'll announce this next week. We won't give families any notice at all. And that's a shame, but that's one thing I would do, but I would have announced that, 4 to 5 weeks ago. What else we can do is we can reduce essential and non-essential businesses to operating at 20% like capacity. So the stores that are open now, they're at 20% like capacity, but those stores that are not open, reopen them at 20% capacity. The other thing is, and this is unfortunate, but I think we're at a spot now that Southern Ontario needs to have 0 gatherings. There's no gatherings outside your home unless you live alone. That should be the only exception, which I think somewhat addresses the whole mental health piece. Not like completely, but I think it does, it acknowledges that that's an issue. But I think that's something that for the next 4 weeks, no gatherings. But I think those 3 actions are what need to be done, but not just those 3 actions. Once you take those 3 actions, it's the supports you must put in place in order to allow those actions to actually happen. And that's where the financial supports come into play. That's where, the daycare for essential workers comes into play. We need to enact some of those things, but that's why, once again, if they announced that schools were being shut, November 15th for the 2 weeks following Christmas break, that would have given us 6 to 7 weeks to plan for this, to make sure that we're set to roll this out for 2 weeks so that we do this the right way so that we actually hammer cases down. But that's what I would do.
Uh, I hate to ask this because I think I know what the answer is and I don't want to hear it. Are we about to screw up the worst part of COVID?
I think so. Yeah, I think, we have unfortunately, we're in a scenario now that schools and gatherings are linked to a lot of cases. We're now coming up on the holiday season and people will inevitably gather. There's been no, announcement saying you're not allowed to gather. We're going to see people gather. And as it stands right now, then schools are open immediately following the Christmas break. We're going to see schools further amplify those cases. And my big worry about the Christmas gatherings is not just Christmas gatherings, but it's the fact that you're going to travel from one public health region to the next. And what's going to happen sometimes is someone who's in a green zone may say, well, I'm safe to have people over because I'm in a green zone. But if you're in a red zone, that's a problem. So, you've got to be very, very cautious of traveling from one zone to the next. And, to go back to what Six Nations has done, when they had made these restrictions in play, when they moved schools online, they also said to the people from Six Nations too, you should not be traveling to other areas which have a higher case count than us. If you're yellow, you shouldn't be going to red. You shouldn't be going to gray. And they were very upfront with that was one of their actual restrictions. You're not allowed to go to these areas unless it's for essential work. So it's that whole messaging piece that I think really, really needs to be there. And I'll be honest, I don't think it is going to be there in time for the Christmas holidays. We're going to see people gather, and then we may even see schools open up after the Christmas break too, and it'll further amplify this.
We were talking about how places that had more of a militarized police, where
Yeah.
their people had a hell of a lot less choice and freedom, they seem to have gotten COVID under control. But then there's also, without knowing the truth of it, are they testing right? Are they announcing right? And so on. But it really seems like places where there was legitimate repercussion for screwing around,
Yeah.
it got under control, except for New Zealand. Whatever New Zealand's done seems to have worked without that. But is it time that maybe the repercussions become more than fines? It becomes potential public endangerment or a severe punishment for making a choice during the next little bit, during the worst of COVID, to go hang out with people. Is it not time people kind of get charged for that as a deterrent?
Yeah. So I think enforcement definitely needs to happen. And I think we're at the point now that it shouldn't just be, words when we're enforcing. I think we're at the point now that it does need to be fines for actually breaking some of these rules, some of these laws, for sure, absolutely. But to address some of those other countries, I think what separates some of those other countries from here in Ontario is they have what we call aggressive contact tracing. So if we look at South Korea, for instance, one thing that they've done is that they're able to access cell phone data. They have CCTVs where they can monitor people as well. And what they would know, for instance, is this: if my cell phone was around your cell phone for a certain period of time, and I had a COVID-19 diagnosis, what they are able to do is send a text message to every single person that I was around. Now, you don't have to download the COVID-19 Canada app for that to happen. It was just simply, you have a cell phone. We're going to text message everyone that you were around, not mention it was you, but say, hey, look, you were around someone, and then we suggest that you get tested. And I'll use one example of that. There was a South Korean call center, and one individual had entered the building, and they had COVID-19. Now, what actually happened is from that, they said, okay, you know what? Let's track this person's phone and let's send messages to all the people that they were around and that those people were around as well. Well, that blossomed, that one case, it blossomed into 97 cases. And the reason that I bring this up is that here in Ontario, we never would have found those other 96 cases. We would have found one, and we would have found some of these other ones once they propagated on to many, many other people. But what they were able to do there is they actually tracked that down, and it was one person was at a call center on the 9th floor. But I guess what must have happened is in the elevator or in the main lobby, they passed it on to someone on the 11th floor. Now that person on the 11th floor went to work sick, and they passed it on to about 45 other people at the 11th floor call center, who then all brought it home to about 45 to 50 other people at home. And that was all linked to one person that was at the call center on the ninth floor. They caused all those infections at the 11th floor and to the families of those individuals too. And I think that's an interesting study because I think what it shows is that if you aggressively contact trace, then you're able to find these cases. At least here in Ontario, the solution for that would be if you got the COVID-19 app. I think it's a really, really beneficial thing. It's not tracking phones that way. It doesn't know it's, Sarah's phone, it's Jay's phone. It just simply, it's like, it's a phone. We'll send the phone the code, but it's still up to that person whether they get tested or not. But that would be my big suggestion, is something that we can do. We can download that COVID-19 app, and then we can go from there.
Are you familiar with the outbreak that was at UWO in London just after the school year started?
Yes.
Did you see any of the contact tracing that was done? There was amazing contract tracing that was shown in the London Free Press.
Yeah.
And it was like, shared an e-cigarette here, shared a drink here, and it was like, people.
So you just proved we don't have to lose freedoms. So I went at that with asking about militarized police.
Mhm.
So these are people who are in fear of their lives if they don't listen to the police. So that's not what did it. It was the
Right.
contract tracing.
100%. And I think that's the big difference that we see, is that these areas that have militarized like police, they also have access to a lot of cell phone data. They have also been doing a lot of testing as well. And I think it's the aggressive contact tracing that has brought down those cases, not necessarily the like police, the military, or anyone else like that.
So we know, like most people should know, that your cell phones, whether you have an app or not, are going to track where you are. It's in movies all over the place. It's just at this point it should be common knowledge. So is this just not being done? Like we had a lot of concern about privacy with the COVID-19 app, the Canada app. There was a lot of people scared about it tracking this and that. Your phone already does that. So why
Mhm.
don't they just flip that switch and do the hard, like I'm sorry, when you look at the comparative between COVID-19 and a pandemic versus you're losing privacy on where you have been, which Google sends
I've
me
answered those
monthly.
calls.
Yes. Yeah. Yeah.
It's Google sends me a thing monthly saying, "Oh, this is where you have been."
Yeah.
So, like, why isn't it just let's sacrifice that for a month, know where everyone in Canada has been, not for privacy violations, for tracking, and then from what you're saying is that tends to really get things under control.
Yeah, but you know what though? On the other side of things, if individuals have like issues with the COVID-19 app, which I can tell you, you don't need to have any issues with the COVID-19 app. It's very, very battery safe on your phone. It's very, very privacy safe. You don't have to enter in your diagnosis. It's a super, super safe app. If individuals have issues with the COVID-19 app, they're going to have extreme issues with having their cell phones tracked.
It's all done through your Bluetooth. It's no personal data
I've been on
done at all. It's all
lockdown.
done through the Bluetooth on the phone.
I've been on lockdown since February and I have it. Like, I
Yeah,
don't go outside and I still have it because people may come by me.
100%.
So then we're hearing a lot of stories about we had SARS. SARS, from what we're told, was handled relatively well. There were playbooks built, there was preparedness put in place. And then a lot of people are saying none of that stuff was really referenced and none of that mattered. Is that because SARS is, yes, it's a coronavirus, but or I don't know if I'm saying this right, but it is a coronavirus that is very different. So that stuff did not apply. Okay,
Yes.
so
Absolutely correct. Absolutely. And you know what? Yeah, you know what? You're exactly right. Because I think if you look back to what we did earlier on in the Canada, the early response was not to stop travel from other countries, but we checked the temperature of people. Now, that was great with the original SARS because you would show symptoms within one day, and a fever would always be one of those symptoms. So let's say, for instance, you were, um, if you were in like China, let's say, and and if like COVID acted like that, if you were infected at the airport, by the time your airplane lands here in the Canada, 24 hours later, and you went to disembark from the plane, you would have a fever. You would absolutely have a fever. So we would be able to like catch and stop that case. And if we missed it and they had a fever later on, we would then know who they passed it on to, because that was a very obvious symptom. What we don't see with COVID 19 is we don't see a fever from every single person. The other thing too is that we see a lot of people without any symptoms at all. But I think the most dangerous thing about COVID 19 is it takes between 2 to 15 days for you to show symptoms. It's an average of 5 days. So if somebody transmitted COVID 19 to me right now, I would not show symptoms for another 5 days on average. But during that time, I'm still able to pass COVID 19 on to other people. And the original SARS was nothing like that. So I think a lot of the like, precautions that we had that were built around the original SARS were based off of like taking temperatures, and were based off of a like virus that has a very small incubation period and where all people showed symptoms. COVID 19 is nothing like that.
So if we followed the SARS playbook, it would have been a hell of a lot worse.
Absolutely, absolutely. And in fact, we're still seeing some, workforces like take temperatures every day. And I'll be honest, I think that is almost worse than anything. We should be encouraging people to like take the screening tool every day. Which fever is on there, but it's these other symptoms that are more commonly linked to COVID 19 cases than just having an actual fever.
We have the people dismissing COVID as a new flu, and that's not what I'm doing. But is COVID here no different than the flu has existed? Is it a part of human life now?
That's a very good question. I'm hoping it's not. I think a lot of this is going to come down to the efficacy of the vaccine, which is basically how effective the vaccine is. So if you vaccinate 100 people, how many of those 100 people will now not be able to get COVID 19? What we're seeing now is that it's 95% effective. So if you vaccinate 100 people, 95 of them will not be able to like get COVID 19. If that maintains for a long period of time and we don't see COVID 19, substantially mutate, it's possible that we could get rid of COVID 19. It's possible, but we also have to keep in mind too that this vaccine rollout here in like Canada will be much better than it is in many, many other countries. We have secured more vaccine than any other country in the entire world. So so some of these other countries though may still be able to get COVID 19. They still may be able to pass it on to people who then travel to those countries. So whether we're fully away from it, I don't think so. I think we will be able to get our numbers hopefully low enough that we can manage it well. But I think it'll be around for quite some time.
With with SARS first, sorry, I said that was the last question, but you said something that made me think of something. Um, with we had H1N1, we had SARS, and I know things are really bad, but I keep looking back at the Spanish flu and what I read about it back in school and that, and I think there were still people dying of it 4 years later.
Mhm.
So we're still really ahead of the. I know there's a lot of places that will hear this and think no, but we're really ahead of this. And from what history has shown, a pandemic like this normally reduces population enough to help greenhouse gases. Like there's significant impact on life. And we're not looking at that scale for that long, which is amazing. But we've had H1N1, MERS, SARS, and all these different things that keep creeping out because of the way we live life. And I'm not saying this is one place's problem or the other because we all live if this came from a wet market, there's wet markets in Toronto, there's wet markets in the States. So this isn't saying this is the fault of anybody other than we all do this. and we're
Right.
not going to change. You've seen throughout COVID, we're not really willing to change. Are we going to get another pandemic in? Is it going to be more frequent?
I
Is there?
don't think so. I don't think so. Like based on, I mean, we may see these other things kind of creep up, but like COVID-19 is just one of those things that was impossible to stop because of how many people are asymptomatic and then how long that incubation period is. And I think it's just one of those things, and the fact that it also requires ventilation when you go to a hospital. I think that's it's just a horrible, horrible virus, and that's why I think in the U.S. as of like today, there's been something like 3 million deaths. I mean, it's it's astronomical. The impact this has had like globally. It's insane.
May I ask another question?
Sure.
If I remember reading things about because of all the clothes we're wearing right now have artificial things and chemicals and stuff. And I'm asking strictly because of the opportunity to ask someone who might know or have an informed opinion.
Yeah.
I read that our DNA is weakening. And I remember reading about this a few years ago in the sense that we don't have the ability really because of whatever we've been doing, consuming things, the air, anything, but we don't have the ability to naturally fight things as much. So it's kind of a two-part question. Are we setting ourselves up for something worse by the over cleanliness we've been doing, where we're bleaching or sanitizing our hands, sanitizing everything, sanitizing?
Yeah.
Is the repercussion of how we've handled this with over sanitation, is that going to cause issues, say next flu season, where our immune systems are kind of, I don't know how to express this properly. Do you get
Yes,
where
I
I'm
don't.
going?
Yeah, you know what? And I know exactly what you're saying. And actually, there was an interesting study that was out that actually compared like individuals who washed their own dishes versus who had a like dishwashing machine which was on sanitize mode wash their dishes, and they looked at the number of illnesses like colds and flus which they had, and they found that those that washed their own dishes using a rag and the sink, they actually got sick less often than other people that used that sanitary dishwasher. And I think that sort of addresses what you're asking. It's if there are repercussions of like overusing antibiotics. And that was actually one of the things with the like public health agency of the Canada, which I used to look at, was antibiotic or antimicrobial resistance. The more like antibiotics we take in, the more food that we eat that has been exposed to antibiotics, it means that these bacteria will become resistant to some of the treatment options. And I think that's one of the things, you know, MRSA, which is a bacteria that is resistant to a high class of antibiotics. We may start to see some things like that in the whole antibiotic world. I don't think it'll have an impact on the actual viruses, but I think with antibiotics it actually may.
Okay, and the second part of that was you talked about how vicious COVID is, and that's kind of why it exploded so quick, and why it's still a major issue. And we've got the vaccine which targets the spike protein or whatever. If COVID continues to be around, and we talked about the mutation part about it, we're not sitting there vaccinating animals in that, and we know that COVID has gone, from what I've seen, I can't validate the stuff because I'm Jay. I can't validate things. But if it's in animals and that, does it not chance becoming something completely new and just kicking back out?
For sure. I mean, it could, but at the exact same time, we also have many other viruses which are in animals as well, but they don't become zoonotic, which means they don't actually transfer from animals to humans. And that's kind of what makes COVID unique as well, is that it was one of those things that happened in animals first. They're thinking now it was the like pangolin, and then it was able to enter the human population and become, you know, more infective in the human population than it was in the animal population. So, you know, I think it's such a harmful, you know, deadly virus, and I don't think, you know, we're going to be, you know, seeing something new pop up every year.
I'm trying to figure out the non. I'm just gonna ask it. How are you not throwing punches and pissed off and like just going crazy right now? Because you see the numbers. You've been saying for months, this is how we get this shit under control, and you're seeing things around you that are completely opposite of what you're saying. How you're one of those people who can go, I told you so, every single day for months now. How is that affecting you? Like, how are you not?
It's the school teacher in him.
I think so. Well, you know what, too? I mean, it's, you know, I have met with like the NDP. I have met with Andrea Horvath. And, you know, so I think that there are people out there that do have a vested interest in this data and using this data to actually make positive choices. I have heard from several public health units that have actually reached out to me that say, you know what, we use your data on a like daily basis to make, you know, like, you know, like choices. So even though I'm not fully listened to, I hope I'm listened to enough by some people that I can have somewhat of an impact, even if it's a very small one. If you follow me on like Twitter, I've got stats up every day, and like typically, if I have time, if like when people ask me questions online, I'm able to give really quick answers too. So if there is something which you see on my like like Twitter account, you know, it's got a wealth of information that I hope that people use to keep themselves safe.